So good morning, everyone. I'm Brian, and I'm going to share another deep bite case with all of you, and let's dive into it. So this patient have a protrusive lips and gummy smile, which is the gummy smile part is the big difference from the previous case that Lexi just showed you. So the mechanics here in this case will be slightly different. So the patient has a relatively midline and class 2 canine relationship on the right side and class 2 canine and molar relationship on the left side. And just keep in mind that this patient is already 27 years old. And from this point of view, from the lower left, you can see a relatively deep curve of speed. And you should keep this in mind as well, because this will affect our treatment decisions later. And the patient also have 100% of deep bite, which impinge on his hard palate. From the lateral view, you can see here she has a 6 mm of overjet and moderate crowding on her lower dentition. From our SEP table, she got a skeletal class 2, and she have a proclined upper and lower incisors and a protrusive lower incisors. So the DI score is 21 points. So let's see the diagnosis and treatment plan. So the patient have skill class 2 with deep bite, and even though she had a deep bite, which would not be favorable for extraction case, but keep in mind that she had a deep curve of speed, which made the extraction decision more reasonable. So we decide to go with extraction options. So the decision was made that we will extract all of our first premolars to gain all that space for the relief of crowding. So let's start with the torque selections to begin this case. We all know that class 2 mechanics will eventually clockwise rotation both upper and lower dentition. So to counterclock to compensate that effect and to prevent the dumping of canine, we choose high torque on both canines. And for the upper incisors, it's pretty similar to Lexi Lin's case that we'll choose high torque bracket on the upper incisors. And let's see the side effects. So the class 2 mechanics would extrude the lower molars, dumping the upper incisors. And at the same time, because we extract the lower premolar as well, the bite will be deepened. So how do we mitigate those side effects? We'll need some prevention approaches. First, we'll use incisor screws and anterior torque spring if necessary to prevent that dumping side effect. And also we will use the anterior bite turbo to prevent the bite deepening. And last but not least, we'll need an anchorage from the posterior side. And you can take a photo on this screen, because this slide pretty much explains why even though the approaches are different from Dr. Burstone's research in 1977, because from his research, he suggests that like this case, when the patients have a more excessive incisor show on the front tooth, instead of intruding the lower incisors, you should intrude the upper incisors. And that's also the reason why we use incisor screw on the front part. Like instead of using an intrusive arch with a more complex mechanics or appliance, we use a more simple and efficient way to provide a more a more convenient way for the practitioner to use and for the patients to adjust. So let's see the treatment process. For the first month, because the patients have a very crowding front teeth, so we used open coil spring to relieve the space, and use the posterior bite turbo with GI with glass ionomer cement on the posterior side. On the 8th month, we can see the lower front teeth have been aligned. So remove the posterior bite turbo and put on the anterior bite turbo on the upper incisors, and then plus the Class II elastics. And on the 11th month, because both arches, our wire on the both arches have already been switched to stainless steel wire, so we are able to put incisor IZC screw and interior incisor screws at the same time and start to retract the upper dentition, the whole arch retraction. And we can see on the lower left side, we place the anterior root torque spring to flare the upper incisors further. And this is from the side view. And this is another side. And from the upper sides, we can see the arch shape has developed throughout the treatment. And it has been widened a little bit more, but it's not that obvious. So let's see the lower sides. All right, so let's see the results. The bite has significantly decreased, and even though we didn't gain a lot of corrections of Class II on the left side, on the right side, but for the left side, we can see significant amount of corrections on the sagittal view. And the CRE evaluation, we get around 13 points, which is very good for this case. And this is the most impressive view of our treatment results. We can see a significant improvement on her smile. The gummy smile have significantly be improved. And this is the side view of the patient's image. And let's begin with the lateral ceph. So even though we gain around 2 degrees of clockwise rotation, which might not be favorable for Class II patients, but just keep in mind that 2 degrees of changes is so light that we are not able to notice that from our naked eye. So I think this kind of results is very favorable and is very acceptable. So let's see the impositions. We not only retrocline the upper incisors, but we also retract around 10 millimeters on the front teeth. And for the lower, because the patients, because it is an extraction case, so the bite will eventually be deepened. So inevitably, we have to intrude the lower incisors as well, so that we don't flare it too much. And the lower molars, of course, it will be extruded due to Class II mechanics. And because we utilize both incisor screw and IZC screw, so we are able to gain a total arch intrusion on the upper dentition. So there are 3 keys for these patients. The first one is torque selections, which when you use Class II mechanics, you always have to put a high torque brackets on the upper incisors. And here are some, to prevent those side effects, you have to use anterior bite turbo. And the third one is torque control on the front teeth. And that's the summary of this case. Thank you.